Heart palpitations, heart fluttering, or those crazy skip beats you might feel, they're a lot more common in perimenopause than you think, and they can be so scary, especially when your doctor doesn't realize they're hormonally related. According to studies, 42% of perimenopausal women and 54% of postmenopausal women experience heart palpitations. That's a lot. In this video, I'm going to explain my own story with heart palpitations, what causes them when you're going through this perimenopausal transition, and of course, other reasons that you may be experiencing changes with your heart. Hi, I'm Dr. Carrie Jones, a women's health and hormone expert. Hit that subscribe button because I know hormones can feel like herding cats, and I am here to help. Well, in my own first story, I started getting heart palpitations about 2 years ago, and I had them for about 2 weeks straight. Now, I want to say, first and foremost, if you have any kind of heart symptom whatsoever, always get them checked out. Always get them evaluated by a healthcare practitioner, even if you think after listening to this video that it might just be hormones. It might be, but it might be other reasons, which I'm going to talk about at the end. So for me, I, being a doctor, listened to my own heart. I had my 3 best friends who were doctors listen to my heart. I was definitely having what are called PVCs, the skipped beats, the irregular beats that were happening. And sometimes they were so intense and they would go through runs of skip beats that I would cough or I'd have to clear my throat to get it to stop. And I tried everything natural while waiting to get into my own doctor. I tried magnesium, I tried calming herbs, I tried breath work, I tried meditation. I tried so many things. I didn't think it was stress, but I was addressing stress. I didn't think it was anxiety. I was addressing anxiety. I didn't think I was anemic. All these other kind of reasons. I tried them and nothing was working. So fast forward, I get in to see my healthcare practitioner within a couple of days, probably 5 or 6 days. And she works up my iron. I'm not anemic. She works up my thyroid. It's not a thyroid problem. And as she's like, I don't know what the cause is. We did all this blood work on you. I'm not sure why you're getting these crazy heart palpitations. And I'm getting set to go even get like an EKG just in case. I remembered that I hadn't been taking my progesterone and I was very close to my period. So it turns out the timeline for my own heart palpitations that started was leading up to my period. So I started taking progesterone while waiting to see, getting me in for an EKG, etc. And all of a sudden my period started and everything went away and it hasn't come back since. A lot goes in to heart palpitations, but many practitioners forget about hormones and they forget how common it is in perimenopause. Like I said in the beginning, 42% of perimenopausal women and 54% of postmenopausal women experience heart palpitations. Now, what's going on? Well, it turns out that the heart has myocytes. These are the cells, of course, in the heart, and they all have hormone receptors on them. So if there are changes in estrogen in particular, but also estrogen and progesterone, it can affect the way those myocytes work. With women going through perimenopause, as estrogen is going up and down more chaotically than before, this can impact the heart. When estrogen goes down and stays down, what it can cause is a speeding up of the heart, or it can affect how you get the signal to have a heartbeat. So estrogen can drop down and all of a sudden you get that fluttery feeling. You get a skipped beat. And if estrogen is down or going up, then really crashing down, so you feel like you're on a Six Flags roller coaster with more downs than up, you may really get those long runs of heart palpitations because of the hormonal changes. Now, it's not entirely known why progesterone plays a role. Estrogen is much better studied, although not that studied. But it is better studied. We do know that the myocytes, those heart muscles, do have progesterone receptors on them. Therefore, in my particular case, I think that it was a lack of progesterone coupled with a menstrual cycle, a luteal phase, where my estrogen wasn't very high. In fact, at that point, I think it was really quite low. Now, in my whole history of life, I've had heart palpitations before, but they've never been like this. I've had a skip beat, or I've had like 3 or 4, kind of weirdo beats, or some fluttering, and then it goes away. But I've never had it where I felt like it was consistent for hours at a time. And it would come and go, but to be hours at a time where you felt like your heart was fluttering out of your chest, very, very scary. In my case, it didn't turn out to be cardiovascular at all. It wasn't iron, it wasn't thyroid. It was very much hormonal. Now, interestingly, I posted about this on social media recently, and the comments were flooded with women like you who were like, that's me. That's me. In fact, I've had a whole cardiovascular workup and nobody can figure out what's wrong, but nobody mentioned, hey, it might be your hormones. It appears either cardiologists or in OBGYNs or in general practice, I at least know that to be true in my case, they did not realize or were not taught that when perimenopausal women have this fluctuation of estrogen, and especially when it's down for long periods of time, of course, when you're postmenopausal, it's down forever unless you replace it, that it can truly affect the heart in some women. So in the comments of social media, I had a lot of women report that I was having terrible heart palpitations. I got worked up left, right, and center. Nothing showed up. I went on hormone therapy and they all went away and never came back. So I want to put that out there. If you've been really struggling with heart palpitations and nobody knows what it's from, you've had all this cardiology workup, remind them 42% of perimenopausal women and 54% of postmenopausal women have heart palpitations due to the decline in hormones, estrogen, and progesterone. Now, when it comes to the research, here's what we do know that can also kind of play a role. So in some studies, heart palpitations going through perimenopause or through into postmenopause can be associated with a sedentary lifestyle. Okay, it can also be associated with hot flashes, which are the vasomotor symptoms. And this is not uncommon, where women will get hot flashes, and because everything's heating up, they will feel their heart race faster. And I believe this has to do with what's called your sympathetic nervous system. That's your fight or flight system. So that the hot flash kicks off, the fight or flight kicks in because it's really uncomfortable, and poof, the heart races as a result or might start to feel fluttery. So if you notice that your heart palpitations are correlating with your hot flashes, you're not alone. Perimenopausal. It can also be associated with poor sleep. Poor sleep can play a role in the heartbeat itself. It can also be associated with somebody who has a poor menopausal quality of life. I found that was really interesting because some women go through menopause and do really pretty well, and other women go through menopause this whole journey, and it absolutely feels like it's wrecking their life and just affecting their overall entire quality of life. Well, Black women do have more cardiovascular disease. When I went through the literature on heart palpitations, I couldn't find that Black women had more heart palpitations than white women, Asian women, Latin women, etc. But I do always just want to point out that for Black women that are listening, it's really important that you request blood work, such as your lipids, your cholesterol, get your blood pressure checked in particular, because you are at a higher risk for cardiovascular disease. Now, as a side note, in general, women going through this whole perimenopausal transition into becoming postmenopausal, their cardiometabolic markers tend to get worse overall. So no matter what your race is or how you identify, please get your heart worked up no matter what. Please get blood work. Please get your blood pressure checked, because we do know the change in hormones, particularly in this case, estrogen, does play a negative role in your cholesterol, your triglycerides, your glucose, your insulin, your blood pressure, etc. But Black women in particular have a higher risk of cardiovascular disease. So I want to make sure to point that out. Now let's talk about other reasons for heart palpitations besides hormonal, because you could have more than one. You may have some of these other reasons and you're perimenopausal and you're newly postmenopausal. So I want to make sure that we're not missing any of these key features. Now, these are just some causes that could be a reason. There are a whole list of causes, but these are the most common. Cardiovascular disease in general, heart valve issues. If you already know you have mitral valve prolapse, you are more prone to have heart palpitations than somebody else. If you have low iron, so if you're iron anemic or just maybe not fully anemic, but you've been told that you have low iron can contribute. So can low thyroid or high thyroid. So hyper or hypothyroid can cause heart palpitations. It's more common in hyperthyroid, too much. However, I have had a lot of hypothyroid patients that have noticed heart palpitations. I do also want you to be aware, hyperthyroid could also be induced. If you were on too much thyroid medication, one of your immediate side effects you may notice is your heart races or you start to get heart palpitations. If you are hypoglycemic, so if you're having really low blood sugar, you haven't eaten for a while, hypoglycemia can also cause heart palpitations in some people. If you've had too much caffeine or too many stimulants, as an example, that of course can cause heart palpitations. Same as if you were on, there's certain medications, especially think of stimulant medication. Think of your, like ephedrine, that is our in sinus medication, or, you know, if you've got an upper respiratory infection and they put you on something with ephedrine in it, that's a stimulant, and that cold medication could cause heart palpitations or make you feel like your heart is racing and maybe kind of fluttery. Dehydration, because it's going to impact your electrolytes, which electrolytes are a big issue, particularly low magnesium and low potassium. I also saw that in the comments over and over and over again on social media where people said it was my hormones and I realized I wasn't on enough magnesium, or it was my hormones and I realized once I added an electrolyte mix through my day with water that my heart palpitations went away and never came back. So pay attention to your electrolytes. Anxiety, of course, if you are feeling anxious, the heart racing, heart fluttering is sadly one of the keynote immediate symptoms to happen. And I know because I have done another video on anxiety and I've written articles on anxiety because anxiety is very common in perimenopause. And especially when hormones like progesterone go down, it can induce anxiety. And I myself have felt that depending on what month I was in perimenopause. So if any of those ring a bell, or if you've had any history of any of those and you are perimenopausal or you have low estrogen, you're postmenopausal, do be aware that is a common reason for heart palpitations. It's still important, and I know it might feel kind of annoying to have a full heart workup, but remind them right away of your age, that you're perimenopausal or that you're postmenopausal, especially if you are not on any hormone therapy such as estrogen or progesterone, because they need to know that that can be a common reason for any kind of heart changes. You still have to get worked up, but the changes in hormones also play a big role. And I will be very excited when research money goes towards this, because again, if roughly half of women going through this transition get heart palpitations, this needs to be looked in more. We need to really understand this better, really understand and further the mechanism of it, and make the education widely available so women aren't left to freak out. Because when you have heart palpitations and when they go for hours at a time like mine, it is so unsettling. It is so scary. So hopefully that helps you understand heart palpitations. It answers questions for you. You know you're not alone. I have gone through heart palpitations myself. Lots of people I've seen on social media and when I was in practice also experienced heart palpitations. Perimenopause, postmenopause, estrogen, progesterone definitely seem to play a big role. So you're going to want to hit that subscribe button. Make sure to like this video, and any questions you have, pop them below because I love to read them.